Hello and welcome to the Osteogenesis Imperfecta Foundation's podcast series. My name is Petra Harvey and I am the Program Services Director at the Osteogenesis Imperfecta Foundation. On each podcast episode, the OI Foundation brings you information about the diagnosis and treatment of osteogenesis imperfecta, presented by an expert in the field of OI and rare bone disease. The podcasts are a part of the ongoing educational effort of the Brittle Bone Disorders Consortium, part of the National Institutes of Health Rare Diseases Clinical Research Network. Throughout this podcast series, we have talked about multiple approaches to treatment for OI, including fracture care, surgery, treating the whole person, and of course, multidisciplinary care. Today, we will focus on therapeutic considerations for health and fitness for the child with OI with Dr. Francis Baratta-Ziska, Physical Therapy Clinical Supervisor at the Hospital for Special Surgery in New York. Thank you, Dr. Baratta-Ziska, for joining us today.
Hello, and thank you for inviting me to speak with you. It's great to have this opportunity.
Awesome. Well, we're very appreciative of the work that you and the team of physical and occupational therapy consultants have done to complete a newly revised brochure. We receive a lot of questions from physical therapists working with children and their parents, as well as adults who would like more guidance about strategies to develop care plans and maintain as much physical independence as possible. As always, the OI Foundation recommends to consult with a physical or occupational therapist experienced with OI about your personal treatment plan. This podcast is made as a service to the OI community and does not serve as an endorsement of any particular plan. So let's begin. We're hoping to cover a good amount of information in the next 25 minutes. Our first question is, can you explain the difference between physical and occupational therapy? And what are some of the common reasons children are prescribed PT or OT?
So most times PTs may focus more on those gross motor skills that are related to a child's ability to move about at home or at school. And the PT may focus more on the child's mobility needs. So working on how the child moves on and off their bed, how the infant or child moves about on the floor. Is the child, with OI scooting, or are they crawling? Are they able to get up from the floor? Are they able to walk across the room? Do they use any type of assistive device? And are they having any problems using the assistive device or moving around the room? OTs focus more on those fine motor skills that are related to a child's ability to perform self-care activities and activities of daily living, such as are they able to feed themselves and how do they feed themselves? How do they take a bath? Do they need help getting in and out of the bathtub? Are they able to sit with good balance while they do their hair? Are they able to, hold a pencil for handwriting or turning a page of a book? Things like that. So OTs focus more on those fine motor skills related to self-care and ADLs, and the PTs may focus more on those larger gross motor skills related more to mobility. And a lot of times children are prescribed PT or OT when they have difficulties in these areas. And that can be if they have weakness or muscle imbalances, or following surgery, or following a fracture where they might be immobilized. And these are reasons why they might be referred for physical therapy and or occupational therapy.
Okay, great. You mentioned injury or surgery. When a child is prescribed PT after an injury or surgery, what are some of the special considerations that you have in mind before meeting with them? Do you wait for an initial evaluation to determine your outcome measures, or does it depend on the type of OI?
So most times what outcome measures I use during an evaluation is dependent on my findings and impression from the initial evaluation. But before I meet the child or the family with OI, some of the special considerations that I keep in mind is I try to meet them in like a quiet, private place so that the family and the child can speak privately to me, being respectful of their health information. I also make sure that they feel safe in the environment. I don't want the child to be fearful of people moving around them, not being aware of their considerations of OI. And also, I also try to, if possible, either contact the doctor that's referring the child and or access their medical information from either the electronic medical records or a chart review or just a conversation with the doctor to find out, some results from diagnostic testing that would influence my, plan of care, such as has the child had any x-rays to establish, the stability of the cervical spine? Have they had a bone density that gives me a sense of how osteoporotic they might be, when the last fracture was, and how did they acquire the last fracture? I mean, some of this information I can get from the child and the family, and some of it is good to know beforehand so that I can get a little bit of a picture of where we're starting from.
Okay, great. Can you explain some of the considerations you would suggest for a school physical therapist working to adapt the classroom setting or maybe develop recreational activities?
Sure. First, I would suggest for the school PT, again, to interview that child and get a sense of what the child needs to do in the classroom, how the child needs to access their educational needs. Is it a younger child where in kindergarten and first grade they spend most of their time in one classroom, or is this a child that needs to be moving about the whole school? And so when you think about a child that needs to be moving from classroom to classroom, then you start to think of, well, do we need to consider a proper sitting area for the child to be in group setting with their peers so that they're all on the same level? Is the child able to get down on the floor during reading time if they're doing circle time on the floor? Does the child have a properly fitting chair to sit at a desk in order to do any tabletop activities? The other thing a school therapist can assess and help the child with OI move about safely in the classroom is whether or not they have enough space to maneuver any assistive devices. So does the child need more room to move around the classroom to negotiate a walker or a wheelchair or crutches, things like that? Because we don't want the child not to be able to access the front of the room or a reading area or any areas of the school because of assistive devices. Another thing that school therapists can help children with OI with at school is teaching the child how to delegate and also how to describe why they need to have like a safe space around them, why they don't want children to come and bump into them, and to learn a way to talk with others about how others can help them if they need help. And so sometimes that's a tricky area for kids. They don't know necessarily how to tell others how to help them, and so the school therapist can help with that conversation as well. In terms of developing safe recreational activities, it does depend on the child's type of OI and also how fragile they are. So depending on that and also the doctor's guidelines in terms of what activities they should avoid or be more careful with, it's usually, we try to tell therapists to avoid high-impact collision sports that the child might participate in. So things like dodgeball or football or basketball. Even though basketball is not a contact sport, sometimes there is some fouling going on. So those are sports and recreational activities that we don't usually recommend for children with OI. Or any sports that require twisting or sudden stops and starts, because there the muscle pull on the bone can also cause a fracture. So we want to just be mindful of the movements that are involved with certain recreational activities and what would be safest for the child. We certainly don't want to exclude the child from participating in activities with their peers, and we do advocate that the therapist work with the gym teacher and the child to find ways that the child can participate, let's say in cheerleading. So rather than doing some of the jumps and flips that might not be the safest for a child with OI to do, perhaps doing more of the cheering and the static postures might be a better way for the better and a safer way for the child with OI to participate in that particular sport. It also depends on what the child is interested in participating in. So I first start there. I usually want to ask the child, what activities here at school would you like to participate in? And then we work our way from there, trying to make it the safest and most enjoyable experience for the child.
Awesome. That's really helpful information. I think that we've covered a lot today. If you have any questions, then I know Dr. Baratta-Ziska is willing to help answer questions. We also have other physical therapy consultants. You can email bonelink@oif.org if you have any specific questions about what Dr. Baratta-Ziska discussed today. And also just want to make another plug about the new physical therapy and occupational therapy guide that was just published and revised in September 2017. So thank you so much again, Dr. Baratta-Ziska, for joining us today.
Oh, you're very welcome, and it really is a privilege to work with you and the whole organization. And I hope that what we discussed today was helpful to children and families that are living with OI.
Very good. Thank you. Well, we'll be back another next month to record another podcast. Thank you so much. Make sure you tune in. Bye-bye.